Welcome to our instructional video on assembling the rigid oesophagoscope. Your standard kit will contain a variety of sized oesophagoscopes, forceps, light carriers, handle, light cable, bite guard, and towel clip. Rigid oesophagoscopy is often performed for biopsying tumors or for removal of foreign bodies. It is important to be able to differentiate the rigid oesophagoscope from the ventilating bronchoscope. This scope does not contain any ventilation ports along its shaft. There is also an attachment for a handle, shown here. First, it is important to decide on which light carrier to use. The first type, shown here, clips in at the end, but it provides a partially obstructed view and is less likely to be soiled by blood or foreign bodies. The longer type of light carrier, as shown here, which inserts along a port on the internal lumen of the oesophagoscope, provides light at the distal end of the instrument. After deciding on the light carrier, the light lead is attached, as shown here. The handle is attached next. This screws in as shown. Always check that the handle is secure to avoid injury to the patient. Two different forceps are commonly used during this procedure. The cupped forceps, which are used for performing biopsies, as shown here, or the Chevalier Jackson or tooth forceps, often used for removing foreign bodies and food boluses, as shown here. Thank you for watching.